So what are the things that we look for in the labs? When the patient comes back to me after initial follow-up, I always start with where it all begins, right? Genetic testing. And I'm just going to pick through a couple of things because next month is going to delve more deeply into genetic testing. So let me just pick on the top 3 that I look for. And there is a company that I prefer over one or the other because they will look for these things in them. Okay. So BDNF, I talked a little bit about that. It's a buzzword right now, but like I was trying to figure out what this is, but really it is a protein in the brain that helps in the plasticity of the brain. That means the brain's ability to heal itself. And it helps with brain connections. And it is very important to know this, especially when it comes to people who've had brain injury who continue to suffer from cognitive deficits. I have a patient who is a NFL player, 10 years. Of course, as you know, those are the people with CTEs and constant trauma to the brain. Why is it some of them don't recover from a brain injury better than others? Well, it has something to do with BDNF, and how you can tell that is through genetic testing. It'll tell you this person has a poor ability to make it, and simple things can be done to treat it. But if you don't know the answer to the question, then you don't know which way to go and how to treat the patient and get them better. And that patient, even after 2 weeks of the treatment I told him to take, able to function better, focus, concentrate better. I noticed he wasn't stuttering as much, even after a couple of months. And then he just told me last week that he credited the program to actually helping him to have the wherewithal to finish editing his book and so forth. So that was a really good feeling to know, but all because we found out his BDNF was not working right, or he was not creating enough of that. So that was a really good story to just share. That was amazing. MTHFR, I think we all know about this, right? Sort of. It's just, what I knew about MTHFR 5 years ago is totally different from what I knew about it, just like now, or even 2 years ago. It was sort of revolutionary to help us explain why some people do not have the ability to respond to medications. What if you can't even make your own serotonin, dopamine, or epinephrine, right? So that's why you have treatment-resistant depression with these medicines. They will not respond because drug companies fail to really say, we don't help the patient make this stuff. We only help them keep it around, right? That's what the names are. Reuptake inhibitors, SNRIs, SSRIs, even dopamine. Wellbutrin is the same thing. The concept is keeping the dopamine around. What if you can't make it? Then there's no point of what you're doing with it. That's why the treatment L-methylfolate has already been shown to help treat depression. Because if you don't have enough of it, then you need to replace it. So just like a diabetic, you don't have enough insulin. You need to give yourself insulin. So it's the same concept. It is a genetic issue. So the last thing that I want to just touch on a little bit is the COMT. COMT is it was very difficult for me to even find the information because I even asked some of the smartest people in the country, and they couldn't even give me the concept of what it is. I don't understand this. Well, the whole premise is metabolism of dopamine, right? So if you have a poor ability to metabolize dopamine, you're going to have an elevated level, right? If you have a high propensity to develop to metabolize, it's going to be low. So this is the most interesting gene for me because it is not a standard one type of treatment. Oh, your COMT is abnormal, so this is what you do. No, you have to look at what it is, what it's doing. So when you have high COMT, that's what you call the warrior gene, right? These are the people who can't sit still, who actually do pretty good in chaos. You know, there are good things about them, but then this is also what I see with people who are prone to ADHD. So I like to call this the ADHD gene, okay? Not the COMT gene, the high COMT gene, okay? The other way around, you got the warrior gene. These are the ones that have high dopamine. They don't like change. They're obsessive. Sometimes they don't always play well with others, but it's not that they don't mean to do that. It's just that they have their own set ways. Because if they don't have it this way, all chaos happens and they don't respond well to change or any chaos or change. And they're great when they're left to their own little corner to do their own thing. You can always rely on them to do the job, but just don't give them too much, because you know how the term no good deed goes unpunished, right? You're doing great. Let's add this to it. And all of a sudden they're like having meltdowns and we're like wondering what happened. Fine. Some of these patients that come to me like this, they had no idea. And this is what I find. And then once I found that out, you know, like, okay, the good news is the treatment for any type of catecholamic methyltransferase enzyme, whether it's high or low, is lifestyle. And that empowers people to say, okay, I have to change my diet a little bit. I have to do certain kind of exercises. And for people who are the warrior gene, they may have this overreaction, but you tell them it's going to be okay. You just react to it more than others, but you'll come down to earth and it'll be fine. And they actually feel better knowing that. And some of these patients don't even have psychiatric medicines because they know what is the problem. And that's a good feeling to have, because you put the responsibility on the patient. And because the more you educate them about their problem, they actually, like, some patients have cried and said, you know, it's just not me and how I think and how I behave and so forth. And it's like, yeah, this is how you are made, but these are the things that we're going to do to help you deal with that. So the depression panel, we look at vitamins, mineral deficiencies. Vitamin D, I found, can also predict thyroid results, especially Hashimoto's. Viral infections. There is such a thing as we know, mono infection. Mono infection can cause a delayed overreaction, immunologic response, and cause a lot of inflammation. That's why you see, not only with us, but like a lot of these patients who said, yeah, I've had mono and I'm like tired 6 months later, and we don't believe them. But then we look at their viral loads and it's like, yeah, it's possible that you're still suffering from that. And there's something else that's causing them to overreact. We don't know. Could it be an environmental insult? We don't know. But at least we know this is happening. They're inflamed. Even if I didn't look at somebody's genetics, I can see, not 100%, but like if I look at somebody's genetics and say their homocysteine level is elevated, what do you think, what kind of genetic problem they would have? Think about homocysteine and where it comes from, or what happens to it, why it becomes normal. Homocysteine is metabolized by the L-methylfolate to become serotonin, dopamine, norepinephrine. In order for someone to be able to create those things, homocysteine is involved in that, and L-methylfolate is also involved in that. So homocysteine is elevated. That means no L-methylfolate is happening, okay? And this doesn't just apply to psychiatry. As you know, people will elevate homocysteine level, cardiologists check that, neurologists check that. It makes them prone to blood clots, right? Strokes, heart attacks. And so this is just not applicable to psychiatry. You wouldn't believe the patients that came to me and said, I've had a stroke, and they were MTHR deficient, and said, you need to take your L-methylfolate. Doesn't know is necessarily the case where your MTHFR is deficient and you can have elevated homocysteine, other things going on, inflammation as well. But that's something to think about in the back of your mind. And the one other thing that I also look at when it comes to vitamin deficiencies and metabolism, you need to think about B12. Sometimes when somebody's MTHR deficient, they are also B12 deficient, metabolism of it. So that's why in the protocol that I set for in our clinic, it checks for methylmalonic acid. So this is the reason why I'm also not a believer in people who are getting B12 shots left and right for energy. What if they can't even metabolize the B12, right? The way you can tell, methylmalonic acid is elevated. And how do you treat that? You give them the methylated form of cobalamin. Okay. And so, of course, we also look for, vitamin D levels, magnesium, low mag, what happens, you have anxiety, zinc deficiency. What do you think can happen if you have a zinc deficiency in your hormones? You can have testosterone level that is low. Zinc helps testosterone to be kept around because it prevents it from converting to estrogen. So you can find a lot of information in the depression panel. And anyway, so let's talk about hormones. We test everything. I talked a little bit about vitamin D and thyroids. There is a connection. I have actually, what is the marker for Hashimoto's in a blood panel or a hormone panel? What do we look for? We look for the TPO. Yeah. So I have patients who come to me with elevated TPO, vitamin D deficient, corrected the vitamin D deficient, TPO is normalized. And why is that important? Because the TPO, it attacks your own thyroid glands, makes it inactive, right? And then you just put yourself in hypothyroid. So we can help somebody's hypothyroidism by normalizing their vitamin D. It can happen, okay? All right, of course, it's very important to check these as we talked about when it comes to traumatic brain injuries. You gotta check their hormones. And let's go back to what do we mean by brain injuries? It's not just physical. It could be a stroke, it could be a heart attack, going through a long duration of surgery. All those things are harmful to the brain, along with the drugs and all kinds of inflammation that can happen. So in a hormone panel, we can understand why somebody could have anxiety and insomnia, and looking at somebody's progesterone level and pre-hormone of progesterone can help us understand why they may not have good memory, they may not sleep well, and they may be anxious, and nothing works. So we talked about that way, we look at the brain, look at the thyroids, adrenals, sex hormones, add in their growth hormones. Growth hormone is very important. I now have a portion of the Brain Well program that focuses on weight loss, and growth hormone is a very, very important part of that we don't think about. So it's more than just little kids, getting the height that they need, that there are other benefits to it.